Hi there, my name is Rowan. About 6 months ago, I was diagnosed with type 1 diabetes. I was a normal kid, healthy, happy, and all that. Then suddenly, I had this potentially life threatening disease. The good news is that you can control it, but it's still pretty full on. So, in this video, I want to show you a bit about how it's affected my life.
Hi, Rowan.
Hello.
How did you know that you had diabetes?
I was during the day and just before I went to bed drinking lots and lots of water, like big milk carton full of water. And then when I got into bed, I would have a really dry mouth and just be craving for more water. And also, I was eating really lots.
So, how did you get diagnosed? Like, what happened?
Well, I'd been thirsty and like dry mouth for a couple of days. And then we were trying to get a doctor's appointment, and then we got one, and we went to the doctor's clinic. In fact, it was pretty intense, as Mum explains.
You were drinking so much water, more water than I thought was humanly possible to consume. You were eating so much food, but you were very thin. And I just didn't think that it was right. And we went to the doctor, and she tested, and she was trying. She knew instantly when she saw your blood sugar level reading that it was very, very high. And she was trying to be very calm in front of you, but her eyes were freaking out. And then she had to do a blood sugar level test like you did with your finger prick test. And then she told me I needed to take you to the Royal Children's Hospital instantly. And what happened when you went to hospital?
We went and saw the diabetes nurse, and then she took a big blood test, and then we waited a little while longer, and then they came back with the result.
So, how did being diagnosed with type 1 diabetes make you feel at first?
I was really scared. I didn't really understand or know what it was, and I didn't. I knew that you had to do needles, and I just really was scared of needles before then. Yeah.
You know, I went in knowing nothing about type 1 diabetes with you, and then I had to learn everything about knowing how to help you look after yourself, and that had to happen in 2 days, and I was quite shocked, and so it was quite full on to have to learn all this new information. There was a lot to learn, and also feel very, in shock. I got very scared, and I really was scared that you might die, that you might have a hypo and die, or that you might, yeah.
Was it easy to get medical help
Yeah.
information?
It was. There's heaps of information, and the Royal Children's Hospital were amazing. Our diabetes nurse, Elle, was pretty amazing. She really helped us a lot, and the hospital were great. They really helped so much. I think just the challenge was being in shock and having to learn so much stuff so quickly.
There's a lot to get used to with type 1 diabetes. For one thing, you've got to test your blood sugar a few times a day, then inject insulin. I have to test my blood glucose levels because if they go low, then I have to eat sugar, and if they go too high, then nothing really happens.
But over a long time, it's not
Yeah.
good to have high blood glucose levels.
Yeah.
That's not very good for you, is it?
No.
So sometimes this bit's a bit annoying, isn't it? Because you can't always find blood in your fingertips if you...
Yeah.
Okay, so I'm just going to zoom in. Where's your finger? Okay. So what are you doing now?
I'm just getting the blood glucose strip tester thing.
Uh-huh. It goes into that little
and put
machine.
it in my little machine,
Yeah.
and then wait for it to turn on, and then it will take the blood in and test it. 8.0.
Uh-huh.
So it's
So what does that mean?
so 8.0. Well, anything between 8 and 4 is kind of the normal range that a person without diabetes would have. So 8.0 is kind of just on the edge of high.
Uh-huh. And so why would you have high blood, do you think?
I'm not sure. Maybe because I ate the chips before.
Uh-huh. So you ate a lot of potato chips and potato cakes?
Not really. I ate a few.
A few. Mm. Okay, so tell us what you're doing now.
Now I'm just putting the needle head onto the insulin pen.
So you use a pen?
I use a pen.
Yeah. And tell me about what you have to do.
Well, firstly you need to screw on the needle heads, and then you need to prime up the needle, the actual needle bit, so it gets the insulin flowing through it easily. Then you just wind it up,
Yeah.
and at the moment I'm on 7 units,
Okay. Yep.
and then
I'll just come around so we can have a look what you're about to do.
in my leg.
So how many times a day do you inject? Hang on, we'll just have a look.
I inject 4 times a day.
I'll get over here. Oh, yeah. So you just pinch your skin up,
Yeah, and then put it in.
and does it hurt?
Sometimes you hit a nerve and it really hurts, but most of the time you can't feel it.
No, just like a little pinprick.
Yep.
Okay.
Pull it out and then.
So it's pretty quick.
Yep.
Yeah.
Yep.
And so you inject 4 times a day before each meal. Is that right? And then one before bed.
Yep.
Yeah. And you have a different one at night, a different type of insulin.
Yep.
Okay.
Type 1 diabetes is a serious medical condition, but you get used to all the things you have to do. I asked a couple of other young people, Abby and Cody, what their experiences have been with type 1 diabetes.
I was 2 at the time. I think I was maybe 18 months or so, but yeah, it was 2.
I was diagnosed with diabetes at 4 years old. Being able to have sweet things and things like sleepovers with my friends has been hard.
Yeah.
Yeah, definitely. I mean, because I was 2, I don't really know any different, but it's definitely affected some things that I could do.
I probably can't remember. Yeah.
Because I
was thinking about what things might happen to me at the hospital in terms of like needles.
Yeah. Now.
It doesn't really bother me at all.
Yeah.
It could be a lot worse. I feel like sometimes I still go through those phases like, oh, why does it have to, I don't have to have these and stuff, but I don't really, I don't know any different, so it's okay. Like, it could be a lot worse, I could be terminally ill or something like that, so I try to be positive about it.
Yeah.
No, I haven't. No one else has it at all.
Wow.
Yeah. Have you had any bad experiences with diabetes?
Yes, when I had gastro and we couldn't stop me from going low. Yes, my mum has trained my friends' mums, so now I can go to their houses and it's really good now.
Yeah, that's good.
No, it doesn't really bother me.
The annoying thing about type 1 diabetes is that lots of people don't understand what it is or what causes it.
And do you think they think you're limited by having type 1 diabetes?
A little bit, I suppose, because they can just kind of run around, don't really need to eat anything, and I have to stop and do my insulin and eat, and they can just kind of move on and do whatever.
And do you feel a bit sad about that sometimes?
Yeah, I'd much rather just not having to stop. I'd just rather eat whenever.
How do you feel about having to manage it every day?
At first it was a bit weird, bit new, but now it's kind of just becomes part of my routine, daily routine, and yeah, just do it.
And so what do you have to take with you all the time?
Like my essentials, which I have to carry on me all the time, are my blood testing kit, and a hypo kit, lollies and food.
But you often take everything, don't you? Just
Yeah,
to be sure.
I take my insulin with me in a little bag, which I just keep with me most of the time, just in case we decide to have lunch out or something.
Is there a good side to having diabetes?
Not really a good side. There's an interesting side, I suppose. Kind of knowing how many carbs and how much sugar is in the food you eat. Like before I got diagnosed, I didn't really think about all that kind of stuff, but now I have to. Yeah. So that's it, really. At the end of the day, the reality is that I have type 1 diabetes, and Mum and I just have to deal with it the best way we can. Do you think we're in a good place with diabetes now?
I do. I think it's very much a part of our lives, and I really trust that you manage your diabetes really well. I've seen it, and so when you go out, I don't worry so much, and I really trust that you're doing what you need to do to keep yourself safe and healthy. What's the best advice you would give a young person who has just been diagnosed with type 1 diabetes?
Don't be scared of it. Just think of it as kind of a new friend.
It does get easier to trust that your child will manage. I think it's different if the children are very small and they can't do it themselves and you have to do it. I think the first few months are really difficult, particularly the 2 a.m. wake-ups to check the blood sugar levels, getting used to doing the finger pricking and just kind of understanding the whole thing is difficult, and it takes time, and just to be really kind to yourself, because it is, you're in shock, and also your child's adjusting as well. And so how do you feel about it now?
Now I feel like it's just something that's there. You just have to live with it, and you have to keep it well, and then yeah, it'll be pretty easy.